All right, good afternoon, everyone. Maybe we'll get started. Welcome to our October 2022 Quality Program webinar. So this webinar is part of a monthly webinar series to update and inform physicians of the menu of quality programs options that we have at the CPSO that are available for physicians to participate in and meet their quality requirements. My name is Dr. Ted Everson. I'm a medical advisor with the CPSO, and I work within our quality programs. And I'll be co-hosting along with my colleagues, Dr. Mary Manno and Miss April Jacobs. Maybe Mary and April, if you wanted to introduce yourself. Mary, if you wanted to go first.
Thanks, Ted. I'm Mary Manno. I'm a family physician by training and have been with the CPSO since the inception of the program, and I lead the QI for Individuals portion, which we'll talk about more in a few minutes.
Thanks, Mary. And April, did you want to say hi to everyone?
Oh, of course. Good afternoon, everyone. My name is April Jacobs. I work very closely with Dr. Everson and Dr. Manno. I'm the manager of our quality assurance and our quality improvement program suite here at the college.
Great, thanks, April. Just before we get started, a couple other things. We're fortunate today to be joined and have a guest presentation from Ontario Health, and they will be speaking about their clinical quality improvement program options that are available for physicians. In terms of our format today, we'll start with a slide presentation. The slide presentation will be around 45 minutes. We'll start with the CPSO quality program content first, and then we'll transition over to our colleagues that are guest presenting from Ontario Health. We're going to try and leave around 15 minutes at the end for a question and answer period. So if you could either save your questions until the last part of the webinar and or insert them into the chat, we'll try to track them and cover any questions and have any discussion near the end. This webinar will be recorded and saved in a couple of places that you can look for it as a future reference. One is to our website under our quality program tab, so cpso.on.ca under our quality program tab, and as well saved to our CPSO YouTube channel. And this is where you will find prior and past quality program webinars as well. So with that, let's get started with today's webinar. Objectives for today, we want to review and explain the transition that we've had at the CPSO from quality assurance, which was really based on our peer assessment program, to a quality improvement program options that are available for physicians. We will review the tools that we have available for physicians to support self-directed quality improvement activity. And then we'll review and discuss the current state of our quality improvement program options that are available for physicians to participate in to meet their quality requirements that they have with us at the CPSO. As mentioned, we have a guest today, and we've invited Ontario Health to speak to the clinical quality improvement programs that they have available for physicians. Just to start with some background and a couple of the important principles that guide our work at the CPSO, and I'll bring your attention to two of them. One is quality care. So certainly we want to support physicians in providing high quality medical care to their patients, and our quality program options are available for that. And with some of the changes in recent years in the QI-based options, we feel that this is a really important way to support quality of care in the province of Ontario. Another important principle is something called right touch regulation. And this is something that you may not be as familiar with. And this is a principle that guides really all the areas that we're involved with at the CPSO. So not just within our quality programs, but also in some of the other work that we do, whether that's registration and licensing, whether that's policy development, and also in complaint investigations. And so that's something called right touch regulation. And what that is really it's a framework to use, and it helps to guide us and determine the appropriate level of our involvement in a particular area or in a particular matter. And it's based on a risk evaluation. So as we've gone through a redesign of our quality programs and embarked on the transition from peer assessment program and an audit-based approach to the quality improvement options, right touch regulation has been something that we've used to guide that work and that development. Some additional background on quality at the CPSO. Quality expectations and requirements are outlined within the quality assurance regulation, and all members with an active license are required to participate in one of our quality programs periodically. Historically, this had been the peer assessment program, and that program was based on a 10-year interval in terms of once every 10 years, a physician may be selected for a peer assessment. Starting in 2019, we transitioned to the adoption of a quality improvement program and having QI as options for most members to participate in rather than undergoing a peer assessment. Now, peer assessment still exists and remains an important tool, evaluative tool for our various committees. An example would be members over the age of 70 undergoing an age-related peer assessment every 5 years. With our peer assessment program that had been in place for decades, up until 2019, we had been doing approximately 3,000 assessments a year. And in 90% of those, really no problems or issues were identified. So I think this experience highlights a couple of important things. One is that, the physicians in Ontario are generally practicing at a very high level. And so that begs the question and formulates the question of, what is the value that we're getting out? What benefit are physicians receiving by the participation in our peer assessment program? And is there a different way or different approach for everybody involved to realize more value? And that's when we embarked on the transition to adopting a quality improvement approach. And I think this slide outlines the potential benefit with that. So with quality assurance, which is a peer assessment program or audit-based approach, we're seeing an impact or action for a small number of individuals. Whereas with a quality improvement approach, there's the potential to have a bigger impact or broader effect on a cohort of people. And we hope to experience that with physicians that are participating, where even if you are practicing at a very high level, everyone has the potential to make improvements, and therefore, we end up with a bigger impact or broader shift on overall quality. To review again, the distinction and differences between the two approaches, quality assurance is an audit-based approach. It's done by one of our peer assessors and really assessing care that's provided in the past and if it's meeting a minimum standard. Whereas with quality improvement, it's got as an important element of ongoing improvement, is looking and having an impact on care that is yet to be provided. And it's really based on a self-guided and self-directed process of learning. And part of our programs do offer coaching and support as needed. So current state, with the changes we've made, with the principles that we've outlined and our experience with a peer assessment program, we now have rolled out a number of QI-based options for physicians. The current interval for participation is once every 5 years. And essentially the two streams that we have are quality improvement individuals, for which there is a group subset, and as well our quality improvement partnership program, which I'll speak to in more detail in the upcoming slides. And with that, I'm going to pass it over to Dr. Manno to speak to our QI program for individuals.
Thanks, Ted. So the individuals program got underway in 2019 when it was piloted with 260 family physician volunteers. And in 2020, we were able to invite 1,700 family physicians to participate. In 21, 6,000 members were invited, which included, in addition, specialist colleagues from psychiatry, radiology, internal medicine, anesthesia, surgery, etc. In 2022, 4,000 members have been invited and to participate as individuals, and including a new subset called groups, which I'll talk more about in a moment. So we now have participating a variety of physicians working in a variety of practice settings and specialties, and we anticipate to be including members from all specialties in 2023. Next slide, please. So when we think about QI for individuals, the participants have access to an online program called the Learning Management System, or the LMS, and that contains 3 activities for self-directed learning, a practice profile that discusses factors affecting physician performance, a self-guided chart review that helps members to evaluate their own record keeping, as well as a data-driven quality improvement activity that helps you look at your own practice level data for QI purposes. And it's important to know that the content that you record during the 3 activities it remains private to yourself. It's not accessed by the college, but we do check to see that the activities have been completed. So completing the activities will guide you to reflect on your areas of strength and weakness. The idea being that once you've identified areas for improvement, you'll be guided to develop a minimum of 2 and a maximum of 4 goals for improvement using the SMART criteria. And SMART is an acronym that some of you may be familiar with that has to do with developing objectives that are specific, measurable, achievable, relevant, and timely. And we do provide some instruction about working with those criteria for those who have not used them previously. The college also recognizes the impact of COVID and health system constraints and increasing levels of burnout amongst physicians. And that's one of the reasons why one of the PIP goals, one of the improvement goals can relate to physician health and well-being as well. And we can come back to that in a moment. So the goals for improvement are described in detail in one's practice improvement plan. We call that a PIP for short, which is submitted online for review by a quality improvement coach. So invitations for 2023 are underway. Once you receive your invitation, you'll be asked to choose a date for completion. And that is done on a first come, first served basis. I just want to mention that should you choose to complete and submit your PIP in advance of your completion date, then your PIP will be reviewed after the completion date. And I hope that's clear, but if anyone has any questions about that, please feel free to park those for later in our discussion. Next slide, please. So one question that I'm often asked is, where do these improvement goals come from? It's like Cabbage Patch, or how do we come up with these babies? Next slide, please. I'd like to think about each of the online activities and think about how, in some cases, an improvement goal could arise from that activity. For example, this member was a solo physician over the age of 60. Before completing this QI activity, I did not appreciate the impact on patient care, and I had no idea that I was at increased risk of a college complaint. So this individual chose to mitigate the risk and obtain collegial support for their practice of medicine. So in the current state, he had little or no peer support. His intervention, his idea was to rejoin problem-based small group learning by contacting the Foundation for Medical Practice Education. He also decided to apply for affiliate privileges at the community hospital and asked for an invitation to join the local family physician WhatsApp group. And the outcome measure that he was going to use to assess how successful he was in the future state was in 3 months, he would reevaluate his level of peer support. So that's one example of an improvement goal that could come from the practice profile activity. Next slide, please. The self-guided chart review can also be a breeding ground for improvement goals. So this physician, for example, when we went over the results of my chart review, my trusted peer noticed that I often neglect to include negative findings in the record. For example, in a 65-year-old smoker, it would probably be important to document that the abdominal aorta was not palpable. So in the current state, 3 out of 5 charts did not include the significant negative findings. The intervention that this individual chose was to set a reminder, possibly electronic, to document negative findings. And the outcome measure was to conduct another chart review after a period of 3 months. Next slide, please. Now, with respect to the data-driven quality improvement activity, I often hear from members, I had no idea that all that data was being pushed to me. And these members then decide that I can use my screening activity report, which is from Cancer Care Ontario, to create a goal. Or I can embed the I4C dashboard into my EMR. Another source of very relevant data can be observation of one's own practice or thinking about the pebble in your shoe. For example, I'm a therapist. My counseling sessions run late 50% of the time. Or as a specialist, patients have to wait 2 months to see me in consultation. Probably 2 months isn't bad these days, but well, that's another issue. Another physician, I'm a locum. How do I get feedback on my performance? Another example, 25% of my patients prescribed opioids may benefit from deprescribing. Or, as a radiologist, I review about 10 interesting and or challenging cases per week, but I receive little or no feedback on patient outcomes. So these are all examples of practice level data that can be used for QI. Next slide, please. A really important piece is physician health and self-care, especially with the situation that we're dealing with currently in Ontario. This individual looked at the CMA resources online and realized that she could structure a self-care goal for herself. And in her case, she wanted to leave the office for 30 minutes at lunchtime, at least 3 out of 5 days a week, in order to do an activity that would restore her energy and ability to function effectively through the rest of the day. Her plan was to keep track on a calendar and give herself a check mark for each day that she succeeded, and after a month, count her successes and reward herself accordingly. So I just want to point out that there are excellent resources available to physicians, both on the CMA and OMA websites, including in the OMA resources, access to an online tool called the Maslow Burnout Inventory, which actually helps you to measure your level of well-being, develop some very impactful measures to improve one's well-being, and then remeasure at the end of the study period. So very, very congruent with the SMART approach. And I think you'll find reference to those resources in the chat. Next slide, please. So out of all the physicians that engage in the quality improvement for individuals, there are a small number, maybe 15 or even 20%, whose QI goals need some further development. And that could be either because there are issues around clinical care, practice management, or wellness issues identified during PIP review. And in those cases, we do have the ability to invite the members to participate in a coaching session, which is conducted by one of our QI coaches, and consists of usually a video conference of about 45 or 60 minutes, depending on what the needs are. Next slide, please. I'd just like to take a moment to talk about QI for individuals, the group subset, which we've recently developed. Next slide. In the group subset, members can, up to 7 CPSO members can come together to form a group and participate as a group, given that they have some common QI goals. So we started out in 2021 with a pilot. In 2022, we have 101 groups participating, and most of the elements of the program remain the same, except that in QI for groups, the group devises one PIP, and that is submitted on behalf of all the members. Next slide, please. I think I'm going to pass back over to, do we have a summary slide of all the different options, or?
We do.
All right, that's going to come a little later. I'm going to hand it back to Ted now.
Great, thank you, Mary. So we'll shift gears and talk about our other primary stream, which is our QI partnership program. So the QI partnership program, again, similar objectives and similar background with its design, is that we want to engage physicians in doing quality improvement. We know that This can be a great way to change or improve clinical practice. And in the context of the partnership program, the goal and objective is to also support important hospital priorities. So something that is important within your clinical environment at your organization, whether that's a particular quality metric, something in your strategic plan, or something that's been a recurrent issue or discussion at various levels of departmental or other leadership meetings. We also want to recognize that within the hospital environment, um, physicians are generally engaged on many different types of activities. And this is an important consideration when you're deciding potentially what to do for a quality improvement partnership program submission. So the partnership program is designed for physicians to participate in a hospital quality improvement project with their colleagues. And by doing that, they'll be able to meet their CPSO quality requirements for a 5-year period, similar to our other streams that we have available. We do provide access, and it is expected that physicians in this stream will complete 2 of the online reflective activities that Dr. Manno had spoken about: practice profile and self-guided chart review. And post approval and enrollment, physicians in this stream will receive access to those activities. In terms of a partnership project design and what organizations can do, some important points with our experience to date. The scope and nature of the project, it is flexible. We want organizations and groups to do something that is meaningful and relevant to them. So again, maybe it is something within your current strategic plan. Maybe it is a quality metric that you want to focus on. This is an opportunity to engage physicians on that initiative. An important consideration, again, based on our experience to date, is the scope of the project and to align it with the resources that you have available. So depending on quality expertise, quality infrastructure, physician support that's available, develop and design a project that meets the resources that you have available. And we recognize that across the province, there is going to be varying levels and resource capacity across different organizations. The other consideration is that existing initiatives and activities are potentially eligible, and we want to understand how physicians are engaging on those initiatives, and possibly there's a next step or a next stage or another phase for an existing initiative. But this is something that ongoing quality work at an organization is something that can be considered to submit within this program. In terms of the process, organizations submit a proposal to us. So the proposal, we have a proposal form that you use to submit. It's based on a QI project charter format. So you identify and have your problem statement, you have your aim statement, you identify what is in scope, what is out of scope. And I think a couple of the key components for us to understand physician participation is the reflection and feedback. So how are individual physicians signing on to the initiative, reflecting on the problem, reflecting on existing data, and how are they providing feedback on the intervention and any results related to that initiative? In terms of our experience to date, we now have 45 hospitals with approved QI proposals that their physicians and their organization is participating in. There certainly is a focus on organizational priorities. So, the medical leadership at an organization has determined that this is something that we want to focus on, whether that is physician wellness, whether it is some quality metrics that they're focused on, or some other areas that have been identified as problematic and they want to make some progress on. We've had submissions from all spectrum of hospitals across the province, so large community hospitals, larger academic hospitals, all the way to smaller, more remote or community-based hospitals. And this is just a slide outlining some examples of what we've had to date. So Casey House is a smaller organization providing specialized care, and they did two things. They looked at the reduction of unsigned physician orders, as well as looking at increased safety around opioid prescribing. Another organization, Collingwood, did a physician wellness initiative, and they brought in the self-compassion training for healthcare communities course, which is an evidence-based program and utilizes trained facilitators to lead a number of wellness-related sessions for the medical staff. One other example, Kingston Health Sciences submitted 2 projects that their entire medical staff could sign on to. One was looking at resource utilization and looking at Choosing Wisely Canada's hospital designation program, which has been revised and updated for 2022. And they had devised or developed another initiative looking at physician wellness. So just some examples of what organizations are doing. Again, what you can do is flexible, and we can support those discussions. Mentioned the 2 reflective activities. So for a physician participating in this stream, they need to be listed on an approved partnership project, and then they get access to the 2 activities that they're required to complete. With all of that, they would then be exempt from any further quality requirements with us at the CPSO for a 5-year period. The process for an organization to engage in the partnership program is to submit a proposal to us. We work with you on any modifications or edits related to that. We then notify the organization and the leadership at an organization of the approval. We then move on to the enrollment and tracking phase and provide communication and access to the online activities that physicians are required to do. So key messages with the QI partnership program for physicians. Again, this is looking at decreasing some of the redundancy in the various professional requirements that we have as practicing physicians. So by participating on a QI project at your hospital, you can meet the quality requirements that you have with us at the CPSO. We do have alignment with other organizations, so you can concurrently claim CPD credits, whether that's with the Royal College or with the CFPC, and possibly at your home organization. This may help to meet any hospital or academic reappointment requirements that you have. At a higher level for hospitals, we feel this is a great opportunity to engage your physicians on important quality initiatives at your organization because of the additional benefits that they get with participation. I'll mention another stream that we're piloting this year. We've called it QI Enhanced for 70 plus. So as I outlined at the start of the presentation, physicians over the age of 70 are required to have a peer assessment every 5 years. We've been piloting an alternative path this year for physicians that are engaged on a quality improvement partnership project at their organization, that by meeting with one of our physician QI coaches and some further review, this may be an alternate path to meet quality requirements and then therefore not have to go a peer assessment. So this is in progress and certainly more to come later this year and early next year on next steps with this as an option. So to review the current state and expectations with the CPSO for physicians to meet their quality requirements, we've outlined a number of quality improvement program options. So Dr. Manno spoke about our QI for Individuals program, as well as the group's subset. I've spoken about the QI partnership program for hospitals. There's some common elements in terms of physicians participating and engaging on some self-directed quality improvement activities that we provide access to. All the streams come down to physicians participating in quality improvement, whether that's in the context of a practice improvement plan that they submit on their own or as a group, or something that they're participating on at their organization. If a physician is not participating in one of our QI options, then we would have discussions with them about undergoing and organizing a peer assessment. And so with that, we'll transition the presentation over to our guests today. So again, I'd like to welcome and thank our colleagues at Ontario Health from their quality division, We have Tricia Beath, who's a manager within their clinical quality improvement program, as well as Stacy Barziv, who's also a manager at Ontario Health, and they're going to speak about the clinical quality improvement program options that they have available for physicians. And I think this is great content. These are great programs and align really well with what we're trying to do and engage physicians on within our quality programs. So I'm really looking forward to this part of the presentation, and I'll pass it over to Tricia and Stacy.
Great, thanks, Ted. Thanks for having us today. It's a pleasure to be here and have the opportunity to share on our clinical quality programs of the Quality Division at Ontario Health. Go to the next slide. So today's objectives include providing a short overview of each of our programs, and then touching on how your participation in these can be used towards meeting your CPSO QI program requirements. So the first three programs I'll review. These are for physicians who work in acute care, either internists, hospitalists, surgeons, or in emergency care. And then I'm going to hand it over to Stacy, who will review our programs for physicians who work in primary care and long-term care. Next slide. So the first program I'm going to speak about is the Ontario General Medicine Quality Improvement Network, also known as GEMQUIN. This program has the goal of improving care for general medicine patients in Ontario. The program provides two things. One, reliable data on general medicine physician and interprofessional teams via the My Practice and Our Practice general medicine reports. These reports are HTML files that are emailed to participants annually. And we also provide a network of supports that are established to accelerate quality improvement using these report data. So the first report is for individual physicians participating in the program. The My Practice General Medicine Report are confidential data that shows your care patterns and patient outcomes with comparative de-identified data for peers in your division. Use of these reports can support participation in the individual and group quality improvement programs. If you're interested, a sample report is linked on this slide here and can be downloaded from our website. I also think my colleague Tracy might put a couple links in the chat for you for easy access. The second report that's available is the Our Practice General Medicine Report, and this is for general medicine teams. The report includes de-identified data for all patients cared for by general medicine and/or hospitalist services, and it provides comparisons with general medicine departments from other GEMQUIN institutions. These reports can be used to support group or partnership-based quality improvement projects. So physicians and teams who have received these reports are asked then to create a GEMQUIN Quality Improvement Action Plan, which essentially is a quality improvement plan that identifies your opportunity for improvement, your change ideas, and process measures following good QI methodology. And finally, I'll just say to further support teams participating in GEMQUIN, there's opportunities to come together with others from across the province to share resources and to help implement change initiatives and move things along. Next slide, please. So this slide just provides an at-a-glance look at the audience, purpose, and indicators in the different GEMQUIN My Practice reports. Importantly here, I'll just highlight that both of these reports include practical tools and resources to help you reflect on your practice and plan your quality improvement initiatives. Next slide. And also we'll just pause here for a second just to share. This is a screenshot of the Our Practice General Medicine Report. On the left is the dashboard, and it provides a view of all the quality indicators that are color-coded to show if your performance is above, below, or average as compared to your peers, which are other hospitals in the network. And then on the right is a sample of an indicator page, which shows risk-adjusted data with customized comparison and data trends over time. Next slide. The program offers many activities which we encourage you to participate in to help you along on your QI journey. Next slide. So if you're an internist or a hospitalist, we encourage you to ask around or look on our website to determine if your hospital participates in GEMQUIN. And if yes, join your general medicine quality improvement team. So participation on your GEMQUIN team and including the creation of a QI action plan can support your submission to the CPSO QI program. If you have any additional questions or looking for more information on this program specifically, the website details and our email contact are listed here. Next slide. So the second program I'll speak about today is the Ontario Surgical Quality Improvement Network, or ONSQIN. Surgeons from hospitals participating in ONSQIN have access to data on surgical outcomes through the American College of Surgeons National Surgical Quality Improvement Program, or NSQIP. So each year, teams participating in surgical QI create a surgical quality improvement plan using their NSQIP data. Their plan identifies an outcome measure, change ideas, and process measures to support their chosen QI project. So participation on your surgical QI team can support your group or partnership-based quality improvement projects. If you're interested in more information or to find out if your site participates, please check out our website here or email us at this address for more information. Next slide, please. Another source of data available to surgeons, and specifically for orthopedic and general surgeons, are the My Practice surgery reports. These reports provide surgeon-level data on post-operative opioid prescribing for select surgeries. Both these reports include practical tools and resources to help you manage your patient's pain post-operatively. These reports can be used to inform individual quality improvement plans. Sorry, folks, I just lost my connection. Am I back?
You're back, yes.
Okay, sorry about that. Just the final link here is we encourage orthopedic surgeons and general surgeons to sign up for the reports. Next slide, please. So next up for surgeons, determine if your hospital participates in the program, and if yes, join the team. Again, participating in the creation of your hospital surgical quality improvement plan can support your submission to the CPSO QI program, and sign up for your practice report if it's applicable to you. Next slide. And the final program I'll speak about today is the Emergency Department Return Visit Quality Program. This is a program to promote high quality care by helping clinicians and hospitals identify, audit, and investigate underlying causes of return visits to their emergency department. The program's main focus is on promoting a culture of continuous quality improvement in the emergency department. Sites participating in this program complete a minimum of 50 routine audits on return visits, and where quality issues are identified, steps are then taken to address their root causes. Next slide, please. So if you are a physician participating in emergency care, we encourage you to determine if your site is a part of this program and consider joining your QI team there. And this would include participating in the audit process at your site. And again, this work can support your submission to CPSO QI programs. The email address for this program is available here if you'd like more information or would like to contact us. And with that, I'm going to hand it over to my colleague Stacy to speak about the next programs.
Great, thank you. Really appreciate the opportunity to be here. Our team's been thinking a lot about how we can build alignment and synergies for physicians to know how their quality improvement work can be used for the different quality improvement programs like the CPSO and their quality improvement plans. So really happy to have the opportunity to be here. I'll be speaking today about the My Practice reports for long-term care and primary care. These reports strive to provide data on relevant indicators to support QI initiatives and optimize patient care. Specifically for long-term care, actually, can you go to the next slide, please? For long-term care, the report enables physicians working in long-term care to see their own, to see their own prescribing patterns in comparison to their peers and practical ideas for improvements. There are currently 425 physicians registered, and data is provided on antipsychotic usage, falls-related medications, antibiotic prescribing, with evidence-based change ideas to get started on your QI work. And importantly, the data can be used for your submission to the CPSO QI program. Next slide, please. This slide shows the landing page for the long-term care report. The design was the result of lots of consultation with digital teams, general feedback from behavioral experts and stakeholders, and is designed so that a physician could grasp really quickly how they're doing compared to their peers. And like all reports, there's trend data and more detailed data for each indicator inside the report. Next slide, please. In addition to confidential data on prescribing patterns in relation to peers, there's lots of links embedded to QI resources and tools to get you started on your QI work. And to sign up for the long-term care reports, you can go to the email here, hqontario.ca/long-term care reports. Next slide, please. I'm going to turn it over to the My Practice reports for primary care. These reports provide aggregate physician and practice level information to support quality improvement and compare to your peers in Ontario. As of February 2022, 49% of eligible physicians, that's 4,769 physicians, and 96%, that's 172 of 180 eligible family health team executive directors were registered. And indicators in the report include opioid prescribing patterns, diabetes management indicators, cancer screening indicators like colorectal, pap and mammogram screening, and a bunch of health utilization data, including ED visits, hospital readmissions within 30 days and 1 year as examples. And then reports also include my patient demographics and disease cohort, as well as lots of QI change ideas. Next slide, please. The My Practice reports are voluntary with online registration, and the reports are sent as PDF documents by email, released quarterly with data refreshed every 6 months. And then I've included the link to register, which, like all our links, are available on our website. Next slide, please. So this slide, it's a little bit hard to see. Sorry for that. It's a bit of a snapshot of how the data is received in the report. There's an indicator summary. There's a line that shows the data compared to your peers, and also a snapshot of the demographics and the disease cohorts. So I'm actually going to skip over to the next slide because it's very hard to see. Okay, next slide. Yeah, so I've already talked about the indicators. Sorry, if you 2021 survey of My Practice users. We do normally do an annual survey. We didn't do one last year, but we're planning on doing one this year. We ask about the data and the reports and any opportunities to improve. And we heard that 54% wanted augmented tools to be able to use the data for quality improvement. So in 2022, we launched a CME Main Pro accredited webinar series to really dive into the different indicators and help people use the data for improvement, to bring in clinicians to share how they were using their data, to talk about how you can look at your data from an equity lens, and all sorts of different. So these webinars were recorded and they are all available if you want to use them. And we will have an upcoming webinar on November 10th focusing on the opioid prescribing indicators. And there's the link to the recordings. Next slide, please. We also created a primary care quality improvement hub on our quorum space. That's a space on our website where we've tried to bring together all the quality improvement resources that touch primary care from Ontario Health across our different branches. So things like the clinical quality standards. They've developed a one-page tool for primary care, all the data from My Practice report, and tons of QI resources, as well as links to some of our partner programs. So if you want to get, that's open to everyone, and we encourage you to sign on to that to get resources. Next slide, please. I'm going to skip over the next two slides. These are just some additional resources, so you have them if you wanted to easily link to them. Those were the quality standards for primary care and links to the quality improvement plans, tools and resources, just so you have it all available, because we're going to make these slides available after. And then just to say that we are eager to support you in your QI work. I put our email here, our link to the Primary Care Quality Improvement Hub. And the next slide also takes you, I believe, just to some additional general QI resources that are available at Ontario Health. Just lots and lots of tools, webinars to get you going on your QI journey, and we're really keen to support you. And then I think the final slide that I have for you is the next one, which is we wanted to bring together an alignment of our different clinical QI programs and how they align with CPSI QI programs. So putting it all there in one slide. And I think that's it. We wanted to save lots of time for questions, so thank you for the opportunity.
Okay, great. Thank you, Stacy, and thank you, Tricia. And yeah, that's a really impressive content that you've provided with us, and I think really illustrates you have quite a deep basket of QI resources and supports and guidance for physicians. So that's fantastic. Thank you so much for coming to present. And I think it really, fits nicely with what we're trying to do at the CPSO, and really what other organizations are trying to do. This intersection of supporting physicians to do quality improvement, meeting any requirements that they have, with their various professional organizations and associations, and everyone has the, overall goal to improve patient care. And I think there's a lot of resources and support out there, and that's great. Thank you so much for coming today. So let's move on. We have approximately 50 minutes remaining, and we wanted to leave this open for any questions that have come up. So, we can open it up to that. April, I don't know if there's anything that's been put in the chat, or if you want to coordinate any questions that have come up during the webinar.
So just one question in the chat right now. It's actually from Dr. Manno to Ontario Health. So Mary, did you want to go ahead?
Yeah. Thanks again. That was a really terrific presentation. And just also want to point out that with the Quorum Hub, there's also community of practice that physicians can join and get help from one another to work towards the QI goals. So that's another resource that I found very helpful. Stacy, I had a question about the My Practice reports, and I wondered whether it's actually a requirement to have an EMR in order to access the reports.
So I'll take a stab at it. To access the reports are sent by PDF, by email. So you get your data as a PDF. In terms of the development of the report, I'm going to look at to Way, our partners in health system performance, do the actual report development. But I do believe that you do need that. But Way, I'll turn it over to you.
Sorry, I just want to clarify. So for the reports generated based on patient records, that's de-identified patient records. So it's reported at your practice level. For you to access report, you need to go to our official website to sign up for that, and then share your CPSO number so that we can use your CPSO number to link for your data in the admin database.
Thank you. I think the point I was trying to clarify, a physician who, for example, uses paper charts rather than an EMR can still access My Practice report. Obviously, you have to have a computer, but you don't have to be an EMR user in order to have practice level data in your My Practice report. That's my understanding.
Yeah, correct. Yeah, so the methodology for getting your patient data to your practice level, we are using the OHIP, mainly the CAPE, the OHIP database. It's not extracted from your EMR.
Great, thank you.
Mm-hmm.
So we're open for questions. So if anyone that's signed on wants to ask a question, you can go ahead, unmute yourself and go ahead. And if there was nothing else in the chat, I don't know if there's, whether it's a clarification or a question, we'll leave it open right now.
So Ted, we're open to questions regarding the CPSO QI program itself, as well as the Ontario Health component, if there are any.
It looks like we did a tight job of explaining everything today. There doesn't look like there's any questions right now. So just to start to finish up here then, the presentation's been recorded. It'll be posted onto our website. It'll also be saved to our CPSO YouTube channel for future reference. In terms of next steps, if you have any further questions or clarifications for us or for the programs that were presented from Ontario Health, I think contact information has been shown on the slides, and we can always assist with following up on that. Yeah, anything else from everyone who presented today? So Dr. Manno, Stacy, or Tricia, anything else to mention or to clarify?
The only thing I can think of in addition would be just contacting us at the CPSO. It's always possible to just simply email quality@cpso.on.ca, and one of us will respond from the QI team.
Okay, all right. It doesn't look like there's any other questions or comments. So again, thank you to Stacy and Tricia from Ontario Health. Excellent presentation, really fantastic resources kind of spanning different areas of our system and for different specialties. So thank you for doing that. Thank you to everyone for signing on to the webinar. And please reference the saved presentation for clarification or reach out to us directly. And I think that's everything. Thanks, everyone. Thanks for attending today.
Thank you. Bye now.
Thank you.